Hello everyone. So this video is very dear to me, and also make sure you watch till the end of this video because very useful tips are being given by Dr. Srinath regarding how you should deal with the last 2 months of preparation for NEET exam, especially the DM neurology part. And why this video is very dear to me is because I had in this 1 year of my experience in training the DM neurology residents. Almost last year NEET we had about very good results. About 33 were in the top 100, and about hundreds of students have joined various DN and DNB courses all over. And it was this person whom I am going to show you the interview was the one who had given me like a gift, maybe simple, a card and a pen on my birthday. But that gesture of simple gift gave me a lot of motivation to go ahead. With that, let's just see this interview, which has
Morning,
got
all
very
DM
important
neurology aspirants. We
insights
have on
into
board
how
with
to
us Dr.
deal with
Srinath, and
the
who
NEET
had
as well as
acquired
the DM
NEET
neurology
rank of 13, I
exams.
guess, and NIMHANS this year, November session 2020, he got the fifth rank. So congratulations, Srinath, and I'm really happy for you.
Thank you so much, sir, for having me.
So exactly when did you actually start your preparations?
Sir, so the answer to that again, my initial plan was to go through MRCP, but because of COVID, everything changed. So I started studying for NEET actually probably towards the end of March, beginning of April. Started preparing for NEET very rigorously, probably from the end of May. So June, July, and August, probably 2.5 to 3 months of good studying was what it took to clear the exam. Either AIMS or NIMHANS was my primary aim. So, and NEET, of course, was my second option. But I feel that the fact that I wanted to get into the best institute in the country motivated me. And before I started studying, I felt it was very important that I saw myself achieving my goal or objective. I saw myself, yes, I will clear NIMHANS this time. I will clear NEET this time. And I visualized myself seeing that success, and that motivated me to do better. I feel that really helped a lot.
Yeah, that is a good idea. Like trick yourself to working hard, like visualizing
Yes.
sitting in NIMHANS doing neurology residency there. As everyone I have talked to had came up with the answer that preparing is basically reading Harrison. So, do you stick with that Harrison thing, or did you do something extra more, or skipped reading Harrison, something like that?
I had read Harrison very well for my MP 5 years, so I was very happy and confident with Harrison. On top of this, I had also read for neurology specifically. I had read Snell's neuroanatomy for my MD exam because I felt it was important that I brush up with my anatomy. So this I felt gave me a good platform to build upon, and I did questions. One is from a textbook by Dr. Ajay Mathur. Second is I had registered for Speed online courses, so that also helped me out more of the questions. And then I think that was probably I would have been at the same level as everybody else. And I'm not bragging here. After I joined your group and started doing your questions, that is what actually helped me take that next step up. Doing as many questions as possible, doing as many tests as possible. So this, your question answer along with speed questions, they really made a huge difference. Regarding other textbooks, personally, I did not feel I had to read anything other than Harrison. I think Harrison was enough.
So you studied and you knew the concept well from the MD period, I guess, because you had completed Harrison. So did you make notes of Harrison then itself, or like after starting preparing, you made notes?
I didn't make notes. I did not make notes during my MBA days. It was only while preparing for the entrance exam I started making notes.
So after your this preparation, you wrote the much controversial NEET exam this time, right? So after
Yes, sir.
writing the NEET exam, what did you feel?
Sir, I'll be very honest with you. The exam was very difficult, and my pattern of doing well in examination is I do much better when the examination is tougher. When it's an easy exam, I feel that okay, everyone will do well, and I tend to do average. But when it's a tough applied exam, I tend to do better. So I had a good feeling after I wrote Neet that I'd do well, but I
Okay.
didn't tell anybody. It was a
Yeah.
very difficult exam. It was
Right.
a very difficult exam. The pediatrics part was very difficult, and the neurology was not at all straightforward. Even the general medicine was, I wouldn't say completely straightforward. It was more of knowledge, yes or no questions. You knew it or you didn't know it. Very little reasoning was available.
So by getting such a good rank in NEET, uh, you must have already thought that okay, I have done enough. Now I'll just join one college under NEET and then study. Definitely, you will get all the top colleges which you would have wished for. And what made you that journey again to the NIMHANS actually?
Sir, my initial aim, like I mentioned, was always to get into the best institute. So that itself was a motivation. I still wanted to get into NIMHANS. And secondly, I wanted to get into a place which did good amount of research also. So
Okay.
I wanted to study in a place which would, okay, help me set me apart from the rest of my peers, saying, okay, I have studied in NIMHANS, I have learned this much little extra, or I have this much advantage because I have a little bit more exposure in research or the latest technology, or something like that.
As you rightly said, along with studying, research is also important these days. And
Correct. So,
you can do research in research institutes because they have an organized pattern of doing research and all. But you can do also in all the colleges wherever you join. You just need to have that kind of an attitude towards research. Research doesn't
yes,
mean
sir.
just too much stuff and all. It's just analyzing things and collecting data. So that is actually a good thing
Correct,
you
sir.
had in your mind. I think I will be seeing many publications under the name of Dr. Srinath in future in neurology. And
I hope this.
actually, I was really surprised when you had sent me one gift on my birthday. I remember still now.
Yes, sir.
That was a
Yes, sir.
very so that was really nice of you. I got a Parker pen on my birthday
Yes,
gift.
sir.
I didn't know initially where I got it from. Then only I saw this thing in the address card. It was you. Happy to see that. And after that, you had studied hard to get into NIMHANS, even after getting such a good success in the NEET exam. So that is a lesson to be learned. You don't stop anywhere. I think in NIMHANS also after joining, you should continue this winning streak. That is studying and putting your knowledge to the best use of the patients as well as the younger generations. So this video I plan to make so that I know you will be able to make an impact on the upcoming neurologists, aspiring ones. So any advice from your part to them? So most of them, some of them have got dejected after not cracking into NEET this time and will be preparing for the next time. Some will be in the second year or third year right now in MD medicine, really wanting to get into NEET or any institute exam. So what would you be your advice to them? How do they start preparing?
Fundamentals of medicine are very strong. So give proper respect and integrity to the subject you're studying. Be strong in that. After that, please read Harrison very well and also read a good neurology examination book. If you are sure you want neurology, if you are sure you don't, if you are not sure what subject you want, I would say working after your MD helped out to really understand my passion. So I think it's very important to realize what your passion is, be sure of it, and then follow it. Of course, everyone says work hard, but I also think you have to work smart as well. Studying for 16 hours a day doesn't necessarily mean you'll pass the exam. You have to know what to study, how to study, when to study.
Yeah.
Study probably 6 to 7 hours a day and maybe spending time in a ward examining patients will probably help you better than studying those 16 hours. And always make sure you have at least an hour to 2 hours to yourself to do something you like. And please sleep for 6 to 7 hours. Regarding textbooks, classes, Dr. Subir's classes were very, very useful. The questions are excellent. They were top quality questions. So I think these are what helped me out. Um, be sure of yourself, see yourself achieving your dream, be confident, and go ahead. I'm sure whoever wants to crack it will crack it. Don't be dejected, never give up. It's the most important thing. Always try until you succeed.
Okay, that's a good point. That is, it's not hard work that is needed. Hard work is needed, I would say that, but smart
Yes,
work
sir.
takes you to the top. So smart work just
Very
means,
correct, sir.
yeah, the point like how to study and all. You should before preparation itself, you should have some idea. So that is a very good thing. Otherwise, you won't be going in the right path. Maybe you will be wasting time on the topics which are not important, or that you won't be able to be satisfied with your preparation by the end of your exam when you are about to give the exam. So smart work is the key, and smart work is the key to success of in NEET as well as institute exams. That's true. And one more thing, this video may be being watched maybe by about June, July next year, 2021. So that is the time when this is the last phase of marathon of our studying. So that last 1 month time now, that's very crucial. That changes the whole
Yes,
picture. You have studied everything, you have put everything in perspective in while your preparation is there. But applying it in the question pattern, that is in the MCQ pattern, you must have solved the MCQs here and there. But what should be the actual pattern? What's the mindset when you are in the last 1 to 1.5 months when just before the exam?
so that's a very good question. I think solving MCQs topic wise before those 1.5 months is very important. After those, towards the last 1 month, my personal suggestion is do not try and learn new things at that time. Consolidate what you know. Do questions in a manner. Time yourself while doing questions. Do questions from different difficulty levels. Mix up the questions and do is what I would say, and revise what you have learned. So again, I'm repeating, do not try and learn something new during that time because eventually, inevitably, we tend to forget whatever we've learned. And before the exam, a week before the exam, only questions and revise your notes and sleep very well before the exam. It's very important to go with a very fresh mind. When I was preparing, I didn't have the luxury of having Sir's lectures. So I have been listening to Sir's lecture series right now, Dr. Subir. So I think it's very useful. It builds up your basics. If you're not strong, please do listen to it because it's very good. It's very structured and organized, and it goes from 0 to 100. So I think it's important to not directly go to 100, but make sure you have 0 to 10 in there as well. So I think it's very useful if you can follow Sir's lecture. I think it'll help you out definitely.
Thank you, Srinath. I think you will put this all what Srinath had said into perspective, so that next time I think I'll be able to interview you all, getting into NIMHANS, NEET, AIMS, and PG and GMR. I'm really looking forward for that, and I think from the time you see this video, you should get motivated. Start your preparation if you have not started yet, and neurology is kind of a passion. So if you are really passionate about the subject, nothing can stop you from getting into neurology. And I wish you, everyone all success. In Srinath also, I know he
Thank
will
you, sir.
continue his work in NIMHANS and make us all proud. So with
Thank
that,
you, sir.
I'll stop. Okay. Thank you, everyone. Thank
Okay,
you.
sir.